The latest UK guidelines for sedation dentistry are the IACSD guidelines entitled Standards for Conscious Sedation in the Provision of Dental Care. They were produced by the Intercollegiate Advisory Committee for Sedation in Dentistry. These guidelines are comprehensive, 116 pages in fact, and have been made to supersede all previous guidelines for conscious sedation in dentistry. They also outline the curriculum for sedation training, leading to independent clinical use of conscious sedation techniques for patients. In this section, we will discuss the training requirements, now mandatory in conscious sedation techniques, for use in dentistry, and answer some of the more common questions with regards to ensuring you adhere to the latest guidelines in conscious sedation in dentistry. We will discuss later on in the course the extent of enforcement of these guidelines across the UK at present and what we should expect for the future. These new standards respond to changes in sedation practice over the past 2 decades and in the latest requirements for education, training and revalidation. There was also an appreciation that common standards needed to be applied in the use of conscious sedation by everyone in the healthcare team, dentists, doctors, nurses and other dental care professionals. The new standards were agreed by a wide range of organisations, including the dental faculties of the Surgical Royal Colleges, the Royal College of Anaesthetists and specialist societies. The guidelines were enforced as of publication in April 2015. The SDCEP in Scotland, however, reviewed the guidelines and produced their own updated document in 2017, which is heavily dependent on the IACSD guidelines and agrees on all aspects covered. You will find a copy of the document in full in the resources section of this training. So what is IV sedation? IV or intravenous sedation in general dental practice is, to put it simply, the administration of midazolam intravenously via a cannula, and so long as midazolam alone is used, then it is considered a standard or basic technique in those aged 12 or over. Other standard techniques that can be used for over 12s in general practice with sufficient training are nitrous oxide and oxygen inhalation sedation, oral temazepam, oral midazolam, and intranasal midazolam. But it is important to note that competence in IV sedation is needed for intranasal and oral administration of midazolam and temazepam, in case IV access is required. Any technique other than inhalation sedation with nitrous oxide in under 12s is considered an advanced technique. So, page 21 of the Standards for Conscious Sedation in Provision of Dental Care document teaches us education and training. It states all members of the delivery and care team must have undertaken appropriate, validated education and training and demonstrated an acceptable level of competence by means of a robust assessment process. Solely didactic and skills-based courses without supervised clinical practice, assessment and external quality assurance do not constitute sufficient training for unsupervised practice in those clinical techniques. All educational courses must now be assessed, externally quality assured and incorporate supervised clinical practice. The Sedation Training Accreditation Committee, STAC, accredits all courses in conscious sedation for dentistry. It is administered by the Royal College of Surgeons and reports to the IACSD and the Joint Meeting of Dental Faculties, JMDF. Although the STAC accredit private courses with the aim of improving the quality and availability of training, and therefore patient care, they do not need to accredit courses run by UK universities, Health Education England, NHS Education for Scotland, Wales Deanery, or Northern Ireland Medical and Dental Training Agency, and the Schools of Anaesthesia. as quality assurance mechanisms and supervised clinical practice are already in place. IV sedation training for dentists. Dentist training for the use of IV sedation with midazolam in general dental practice consists of initial theory and skills training followed by 20 monitored or mentored cases as a minimum, as well as intermediate life support training to include blood pressure monitoring and pulse oximeter training. The dentist can work as operator sedationist, although they may prefer not to. And if to be used in paediatric cases, then further training is required. Dental nurses. The Certificate in Dental Sedation Nursing of the National Examining Board for Dental Nurses is the recognised pathway for dental nurses wishing to train in the care of patients being treated with conscious sedation. An equivalent qualification undertaken in primary or secondary care is also appropriate, or the nurse must be working towards this, i.e. undertaking a course but not yet completed it. CPD. Ongoing training, also taken from page 21 of the IACSD guideline document, knowledge and skills must be maintained. Each individual has a responsibility to undertake relevant CPD to maintain their knowledge, skills and competence at appropriate intervals. This is detailed as 12 hours continued professional development every 5 years per technique, i.e. 12 hours for IV sedation, 12 for RA sedation, etc. And this applies to all team members providing conscious sedation, so dentists, nurses and any other DCPs involved. This course will provide you with 12 hours verifiable CPD for the theory and a further 7 to 28 hours for the clinical mentoring. Age of the patient. All medically fit and well patients aged 12 and over can be treated with midazolam IV sedation in primary care. There is no upper age limit specified. In children under 12 with complex oral needs, or where the dentist is unable to treat them with behavioural techniques, a local anaesthesia and or inhalation sedation, then referral to secondary care is required for treatment by a team with skills equivalent to a consultant in paediatric dentistry. Children aged 12 to 16 who cannot be managed with standard techniques need referral to secondary care and should not be treated in the primary setting. So what if you rarely use IV sedation? If practitioners are not regularly practicing a technique, then consideration of mentoring, retraining or discontinuation of its use must be given. This comes directly from the IACSD guidelines and is also the advice from the dental defence companies. So are you compliant? Let's have a look at some examples. I enrolled on a training course prior to April the 22nd, 2015 and I am currently completing my mentored cases. Will I be compliant with the new guidelines? Yes, you are compliant with the spirit of the IACSD standards. When you have completed your training, you will then be covered by the transitional arrangements. I have many years' experience, but no formal qualification. Can I still sedate? Yes, you are covered by the transitional arrangements again, but you must comply with all other sections of the IACSD document. This would include 12 hours relevant CPD per 5-year cycle to ensure training is up to date, as well as the other aspects. So the transitional arrangements. From the time of publication of the 2015 guidelines, no professional should undertake conscious sedation in dental practice without following the formal training pathway as outlined in the document. Experienced practitioners can continue to provide intravenous sedation, of course, assuming they comply with the 2015 guidance. The following transitional arrangements are recommended for those offering IV sedation prior to formal training. Maintain a log of all sedation cases undertaken, with details of the patient, vital signs, sedation details, and any untoward incidents. All team members to undertake 12 hours relevant verifiable CPD in each sedation technique per 5-year cycle. Practitioners must undertake sedation-based audit and reflection frequently. Practitioners must meet requirements for environment and equipment and patient pathway as described previously. Appropriate clinical governance must be in place to comply with the 2015 guidelines, and all records and protocols should be readily available for a commissioning body to review. Care pathways. Research suggests that the need for sedation services may be higher than the level of current provision. It is also suggested that a minority of patients receiving sedation services do not need them, i.e. they can manage with a simpler technique. It is important to have access to a range of support services, from cognitive behavioural therapy to general anaesthetics. This example of a care pathway is suggested by the IACSD. Essentially, primary care should have the facilities and resources to carry out all of the conscious sedation services that do not require a hospital referral. Hospital and community services should therefore be reserved for more complex or special cases. So what next? If you are new to IV sedation in dentistry, then completion of this course will ensure you become a fully accredited and safe provider. If you are an experienced sedation practitioner looking for a refresher course, then completion of the online refresher course alone, without the mentoring, will ensure you maintain your knowledge and keep up to date with your sedation CPD requirements.